Good morning, everybody. I hope you can hear me well. Yes? All right. Okay. Well, this presentation is really about a call for all of us on behalf of children. A call for more effective collaboration, more dialogue between health and education. I'm a medical doctor, I'm a pediatrician, a public health professional, and I acknowledge the experience and the knowledge from my colleagues from education. And I also acknowledge that the power that we would have if we are indeed working together. So this presentation is also a call for all of us so that we take urgent action to put the rights of children at the center of every country development agenda. And it's urgent because our children, our parents, and all caregivers are facing multiple and complex challenges today. And we can think about the challenges, the intensity of these challenges in the future. So it is urgent that we join our efforts and work together. Of course, not only health and education, we also need other sectors, but I think that the center, the core of our efforts is education and health. So let me tell you that the theme of this presentation began in 2023 when Mercedes, Desiree, and I got together and decided to advocate for greater dialogue and collaboration between health and education, and to put the rights of children at the center of every country agenda. So we began to recognize that every sector has a lot of strength. Every sector has experience and has something to offer. And for so long, we have been acknowledging the importance of this multi-sectoral collaboration. This is not new. This is not a new proposal. It's not a new issue. And you guys from education, you have been talking about the need to work together for so long. And let me just give you two examples. In the 2010 World Conference on Early Childhood Care and Education, according to the document of that meeting, the countries who participated in this meeting adopted a very broad and holistic approach to early childhood care and education. And the concept was defined as the provision of care, education, health, nutrition, and protection of children from 0 to 8. Look at how comprehensive it is, the definition. It's not talking about only education sector. It's talking about many institutions, different sectors. And all countries are committed to adopt this comprehensive approach, this multi-sectoral approach. Oh yeah, thank you. And everybody committed in that meeting to start working on that kind of holistic and comprehensive concept. Another example, in 2022, the Tashkent Declaration, if you read the document, you will find that the countries who attended that meeting, they also adopted a very comprehensive approach. They talked about having a whole of a government approach to early childhood care and education. So again, in this meeting in 2022, it was reaffirmed the need that we need to work together. And everybody again committed to start working on that. And this is not only a discussion within education. The health sector also has been discussing the same thing for several years. And let me just give you two examples. In 2015, the UN Secretary General launched this global strategy for women's, children, and adolescent health. And that strategy is a roadmap to make a reality the right to health. And that one of the principles of that strategy is multisectorial approach, is working together across different institutions, across different sectors, not only government, but also civil society and the private sector. So again, from the health perspective, health people were discussing the same thing that the education people were raising. Let me give you another example. In 2018, WHO and UNICEF and a group of other partners worked together to produce this document, the Nurturing Care Framework for Early Childhood Development. This is also a roadmap for action and presents a new term. The document defines the term nurturing care. And what is this term? What is nurturing care? Nurturing care is the conditions created by public policy, the conditions created by programs and services that enable or hinder the capacity of caregivers and communities to give every single child the opportunity to not only survive, but to thrive and reach every child's human potential. This document is the first document that introduces this term, nurturing care. And as you can see, it's saying the same thing that you were saying in your documents, in the education documents. So nurturing care, it's comprised of five components. What are those components? Good health, nutrition, responsive caregiving, safety and security, and opportunities for learning. Every child needs these five components to reach the child's human potential. And all these components are interdependent, interrelated. And as you can imagine, to provide all these components to a child, it requires the work for several sectors and institutions. It's not referring to what the health sector is doing, or the education sector is doing, or the social protection is doing. It's talking about what children need to develop to reach that human potential. And every child needs all five components. And they need the components to reach the child early in life, as early as possible. And all these components need to reach every child simultaneously, at the same time, as close together as possible. From pregnancy to the first years of life. But we don't stop there. We continue to the middle-aged childhood, adolescent, and so on. And this term, this document, Nurturing Care, emphasizes the critical role of relationships for the development of every child. Relationships between children and people, especially the adults, who have a significant presence and role in the life of the children, but also the relationship with the environment, with the children's context. And that's very important, is for the first time is defining that everything that happens to a child depends on that relationship with people and environment. We don't talk about children in a vacuum. Whatever happens with a child, it has to do with the adults in the life of that child. And it has to do with the environment where that child is born, is growing, is playing, is socializing. It's that environment. So that is something to keep in mind and always take into account when we are defining our daily activities in our profession. So, as you can see, in the most important and sensible times in the human life, those first years of life, both sectors, education and health, are present in the life of the children. And we have so much in common. Both sectors recognize that our outcomes are interrelated and interdependent. We need the health people, health sector need education to reach our health outcomes. And education needs health to be able to achieve the education outcomes. We recognize that. It's written in every document. We also recognize that learning takes place in homes, in communities, in schools, in those parks, in every street, in every neighborhood. And we also, this is something that we both sectors recognize. And we also recognize that when we have effective collaboration, both sectors achieve a lot. The gains are for both sectors. In some, effective collaboration not only allow us to better use resources, to be more effective, but we actually making a reality our commitment to put the rights of the child at the center of our actions. So the common goal of the health sector and education is actually to build thriving and nurturing communities. Building thriving and nurturing communities is like building a house. We need the inputs, the effort, the participation of many. These inputs are coming from education, from health, from labor, from social protection, from private sectors. And all these inputs are used in building that solid foundation. And upon that solid foundation, we keep working together to build an environment that creates opportunities for every child to have long life learning, to have a healthy and productive life, and we make a contribution for citizenship and positive social relations. So imagine always try to remember that what we have in common is building this nurturing community, and each of us put our inputs to make that a reality. The thing what is happening is that there is a gap between what we say and what we do. And we have to, and there is no rule, there is no recipe to find a solution. It depends on the context of each country. But let me give you just some ideas about the way forward for your consideration. The first idea, try to work together to expand and have a common understanding of what learning is and what health is. Learning is not only schooling. Learning happens in every place where children are present. Health is not only not having diseases. Health is well-being, physical, emotional, mental, social well-being. But let's try to discuss these concepts together. And for you, my colleagues from education, I suggest to be explicit and talk about the relationship between education and health in every document, in every plan, in every argument that you have. Invite your colleagues from health to have a conversation and a common understanding of what learning is and what health is. Also, always remember that contexts matter. It matters for health and it matters for education. Remember always to address the importance of child and adult relationships, child and environment relationships. Always have it present, because the importance of those concepts is vital, not only for education, but also for health. That will give you a common goal, a common vision on how to work together. Always put equity at the center. Remember that early childhood education and health are the best equalizers. The children who receive the most benefits are those who need health and education the most. If we want to bridge that inequities in health and education, the best way is to work together. And get together with your colleagues in health and revise the evidence. Together make the new knowledge, the new evidence around what make a child healthy, what make the child learn in a more effective way. My second recommendation is to create opportunities at the local level. Yes, it's true that we need a national level, but it may take a lot of time, it may take a lot of efforts. You guys at the local level can do so much. So keep advocating for a national level, kind of multisectoral, or education and health together at the national level, but start working at the local level. And listen the voices of parents and children. And that is easier to be done at the local level. Always take into account that children who are living in very difficult conditions, they are the ones having problems to learn and to have a good health. And it's easier to know even the name, where they live. It's easier when you start working at the local level, with your colleagues from other sectors at the local level. Together, go and talk to other sectors, social protection, labor, private sector, anybody who is in your area. And try and get together to address common concerns. We, education and health sector, have common problems. Not sufficient funding, not sufficient human resources. Sometimes our working conditions are not the best. That's the same for education and health. We can work together and raise our voice together so that funding is increasing, human resources are considered more valuable, etc. So that would be my second advice. Create opportunities at the local level. And lastly, within your sector, within education, build bridges. Communicate better and discuss better, work together within the education sector. We are used to take pictures in terms of data and information. We describe what happened with primary school children, or we describe what happened with small young children, or we describe what happened in pre-pandemic, etc. We are used to use our data as taking pictures. What I propose to you is to start building a movie and describe the trajectory of the children From the first day that a child knocks the door of that school to the last day of school in secondary. Have an idea how that child is influenced by your work, by the school environment, by your school policies, because that's going to give you a more valuable information to make changes and improve. I also recommend to promote well-being in every grade and make sure that there is a consistent approach across different school grades. And also revise that document, the Nurturing Care framework, and see what is the situation of your school, and see if you can add or make even more better any other component of the Nurturing Care framework. I told you the Nurturing Care framework has 5 components. Do you have in your school all of them? You have only 2, only 1? Whatever it is it possible to add more components? And that is important because that's going to give better opportunities for your child to grow, to develop, to socialize, to actually reach its full potential. Work together, preschool, primary, secondary school level, to better link with community resources. Go together and look and learn what is there in your community. Because some of your families need those resources, and you can be the link between families and those resources. And also together, the preschool, primary school, school level staff get together and try to improve the health and well-being of yourself. We need to have, you as teachers, educators, principals, authorities, you are an important adult in the life of every child. And we have to take care of you. You need to have a good health, physical and mental health. So get together across the school levels and raise your voice and try to improve the health and well-being of every person who works in the school. Teachers, principal, but also the person who is at the door taking care of everything, the person who cleans the school, the person who helps us to move materials around. Everybody should have better health and good, not only physical, but also mental and emotional. So in conclusion, talking about collaboration between education and health is not a new thing. We have been talking about this issue for so long, and we have still a gap between what we say and what we do. We have to bridge that gap. The benefits for each sector are multiple, and we know that. There is a lot of evidence showing the benefit for both sectors when they collaborate. And the time to act is now. We talk about collaboration for so long. Now the time to act is now. Our children are facing complex challenges in life, and we need to act now. Building an effective collaboration is more feasible at the local level. So let's start tomorrow. Let's think how you can start that process and build that bridge between education and health. At the end of the day, effective collaboration between education and health is about children's rights. It's about making sure that it's a reality that every child has their right guaranteed at every age. It doesn't matter where the child lives. It doesn't matter if it's migrant or not. It doesn't matter if indigenous or not. We have the obligation to make sure that every child we are the guarantees of every child's rights. So I want to finish with this statement that I learned from Professor Michael Marmot from the UK. He said, if you are doing nothing, if you are not doing nothing in working together with the health, do something. Start and do something. If you are already doing a little, do more. And if you are doing a lot, do better. Thank you.